Chronic obstructive pulmonary disease is a long-term inflammatory lung condition that obstructs lung airflow. Among the symptoms are wheezing, coughing up mucus, sputum, and breathing difficulties. Long-term exposure to irritating chemicals or particulate matter, most frequently from cigarette smoke, is usually the cause of it. Heart disease, lung cancer, and a host of other ailments are more likely to strike those with chronic obstructive pulmonary disease. Keep watching to learn about the 4 stages of chronic obstructive pulmonary disease and answer more questions about chronic obstructive pulmonary disease. Before we go in depth, did you know that chronic obstructive pulmonary disease is an umbrella condition? The doctors usually use the term an umbrella for several lung conditions that worsen over time. Chronic obstructive pulmonary disease can be brought on by emphysema or chronic bronchitis. You may have symptoms of both of these lung-damaging illnesses, or you may have one of them if you have been diagnosed with chronic obstructive pulmonary disease. Breathing may become increasingly difficult as chronic obstructive pulmonary disease progresses. You should be aware if you are a smoker, as chronic obstructive pulmonary disease is most common in smokers and people over the age of 40. Emphysema and chronic bronchitis are the 2 primary diseases that cause chronic obstructive pulmonary disease. These 2 conditions often coexist, with differing degrees of severity in individuals with chronic obstructive pulmonary disease. Chronic bronchitis is an inflammation of the lining of the bronchial tubes, which carry air to and from the alveoli in the lungs. Its characteristic features include a daily cough and sputum, mucus secretion. Refers to a collection of illnesses that include emphysema and chronic bronchitis. Breathing becomes more difficult with chronic obstructive pulmonary disease over time. While lung damage is irreversible, its symptoms can be controlled with medication and lifestyle modifications. So what makes chronic obstructive pulmonary disease and asthma different from one another? There are several similarities between chronic obstructive pulmonary disease and asthma, including symptoms such as breathing difficulties and airflow obstruction. However, chronic obstructive pulmonary disease is a progressive long-term condition. Allergens frequently trigger asthma attacks. Smoking is the major cause of chronic obstructive pulmonary disease. Asthma sufferers do not always progress to chronic obstructive pulmonary disease. Not everyone who has chronic obstructive pulmonary disease also has asthma. It is feasible to have both of these respiratory disorders, though. You must treat both if you have both. Stages of chronic obstructive pulmonary disease. For the doctors, not only your symptoms are important, but also your forced vital capacity and forced expiratory volume in 1 second, which are the 2 metrics that your physician will measure. So to be diagnosed with chronic obstructive pulmonary disease, your forced expiratory volume in 1 second/forced vital capacity ratio must be less than 0.7. Your spirometry findings will be graded by your doctor on a scale of 1, the least severe, to 4, the most severe. In the previous system, these grades corresponded to chronic obstructive pulmonary disease stages 1 through 4. Your doctor will use the Chronic Obstructive Pulmonary Disease Assessment Test or the British Medical Research Council questionnaire to assess the severity of your symptoms. Stage 1. Early stage chronic obstructive pulmonary disease is regarded as moderate. You might not be aware that there is a problem with your lung function at this point. If your expected result for forced expiratory volume in 1 second is between 80 and 100%, your doctor will diagnose you with grade 1 chronic obstructive pulmonary disease. You might not exhibit any symptoms if your spirometry test results are grade 1. Should you experience symptoms, a cough and increased mucus production are possible outcomes. Early stage chronic obstructive pulmonary disease symptoms might be mistaken for the flu. Stage 2, mild. At 50 to 79% of your anticipated value, your forced expiratory volume in 1 second is classified as stage 2 chronic obstructive pulmonary disease. Your symptoms deteriorate from stage 1 to stage 2. You could start to produce more mucus and cough more frequently, and you might get shortness of breath when you exercise or go for a stroll. This is usually the point at which people become aware that something is amiss and seek medical assistance from a physician. Stage 3. Severe, your forced expiratory volume is between 30 and 50% of your expected value by the time you reach stage 3, when chronic obstructive pulmonary disease is severe. You could find it difficult to exhale when performing domestic tasks and might even be unable to leave your home. Your coughing and shortness of breath may worsen, and you could experience flare-ups more frequently. It's conceivable that you'll tire out more quickly than previously. Stage 4. Extremely bad. Stage 4 is regarded as quite serious. Your blood oxygen levels will be low, and your forced expiratory volume will be less than 30% of your usual amount. You might get lung or heart failure. By stage 4, you'll probably experience potentially fatal flare-ups regularly. Even when you're sleeping, you can have difficulty breathing. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 1. Tobacco usage is the primary cause of chronic obstructive pulmonary disease in developed nations. People who live in under-venturous dwellings and are frequently exposed to fuel fumes from cooking and heating commonly develop chronic obstructive pulmonary disease. While many smokers with extended smoking histories may have impaired lung function, only a small percentage of chronic smokers acquire clinically evident chronic obstructive pulmonary disease. Some smokers experience less frequent lung problems. Until a more comprehensive assessment is conducted, they can be incorrectly labeled as having chronic obstructive pulmonary disease. 2. Smoke from cigarettes. This is the most prevalent cause of chronic obstructive pulmonary disease. Additionally, it can be acquired from tobacco products like cigars and pipe smoke, particularly if inhaled. 3. Secondhand smoke. Living with a smoker increases your risk of developing chronic obstructive pulmonary disease, even if you don't smoke. 4. Air pollution and fumes. These can cause chronic obstructive pulmonary disease. It can also be brought on by breathing in dust, poisonous materials, or chemical vapors while working. 5. Your genetic makeup. Rarely, a genetic flaw in the coding that instructs your body on how to function might cause chronic obstructive pulmonary disease in a person. The term alpha-1 antitrypsin deficiency, or AAT deficiency, refers to this illness. This is caused by a deficiency of a protein in your lungs that keeps them safe from harm. Serious chronic obstructive pulmonary disease may result from this. Ask your doctor for an AAT deficiency test if you or a family member experienced severe lung issues, particularly when you were a young patient. 6. Having asthma. The chance of getting chronic obstructive pulmonary disease might increase if asthma is not well managed. Treatment. The goal of treating chronic obstructive pulmonary disease is to prevent respiratory infections while also managing symptoms, including coughing and breathing difficulties. Your doctor could suggest 1. Bronchodilators. These drugs ease breathing passages. You breathe in a mist that has bronchodilators in it, which facilitates easier breathing. 2. Anti-inflammatory drugs. To reduce lung inflammation, you might swallow or inhale steroids. 3. Extra oxygen. You could require a portable oxygen tank to raise your oxygen levels if your blood oxygen level is low, hypoxemia. 4. Antibiotics. Lung infections can exacerbate chronic obstructive pulmonary disease-related lung damage by weakening already compromised lungs. Antibiotics could be necessary to treat a bacterial illness. 5. Vaccinations. If you have chronic obstructive pulmonary disease, respiratory infections pose a greater risk. Vaccinations are especially necessary to avoid pneumonia and the flu. 6. Rehabilitation. Effective breathing techniques are taught in rehabilitation programs to reduce dyspnea and improve fitness. Maintaining your fitness might help you perform more with your limited lung capacity. 7. Anticholinergics. These medications help release mucus from the lungs by relaxing the muscular bands that constrict around the airways. More air may enter and exit relaxed muscles. The mucus travels more freely and is consequently easier to cough up when the airways are open. Fast-acting bronchodilators function more quickly than anticholinergics, which function differently. 8. Leukotriene modifiers. These drugs have an impact on leukotrienes, which are bodily substances that naturally constrict airways and produce mucus and fluid. Leukotriene modifiers aid in enhancing airflow discomfort in certain people by blocking the substances and lowering these effects. In the past, there were 4 stages of chronic obstructive pulmonary disease, based on how much lung function had declined. To calculate your risk of chronic obstructive pulmonary disease, doctors now combine subjective measurements of symptom severity with the findings of a lung function test. The most crucial thing you can do to extend your life expectancy and improve your perspective after receiving a chronic obstructive pulmonary disease diagnosis is to stop smoking. So, do you or someone you know have chronic obstructive pulmonary disease as a result of smoking? Share with us your experiences and opinions in the comments below. Thanks for watching.